Okay, this is part 3 of antimicrobials, and I just want to finish up with talking about oral irrigation. So basically, irrigation is the application of a pulsated or steady stream of solution. It can be using an antimicrobial, or it could be with water alone. But the purpose is to reduce the bacteria and prevent or treat periodontal disease. So the indications are usually for someone who cannot floss or doesn't want to floss and they'd rather use an oral irrigator, or someone who's inadequate with home care, or having trouble maintaining their periodontal condition, need a little extra help. So there's basically two different types. There's the type of oral irrigator that can be used at home. Usually it's a dull tip, and you can also recommend subgingival, more delicate, professional types if you teach the patient how to use it. And then there's the professional use where they have mechanical irrigators. You can use an ultrasonic or just a syringe with an irrigation. So there's different types of techniques to use. But basically, as far as the efficacy of patients at home using an oral irrigator, the typical blunt tip, basically using it supragingivally, has mixed results. There's some evidence that shows there's positive benefits for multiple patient types. Some studies have shown a reduction of gingivitis and bleeding. Some show reductions and alterations of subgingival dental biofilm. And some have shown reductions in inflammatory mediators. Both water and antimicrobials reduce bleeding and gingivitis. The effect of periodontitis is not well documented. It has been found to decrease bleeding and gingival inflammation. It's most effective when oral irrigation is used with chlorhexidine. Okay, so there's, like I said in the beginning, there's mixed results. So some studies show that it can be effective, and then there's many others that haven't shown such results. So it's kind of a mixed bag. So it may be something if you have a patient who isn't responding and this is something they'd like to try, you want to see how it works for that patient. So there's that standard tip for supragingival only. And there's a very shallow penetration of the sulcus, about 1.8, whatever you're using supragingivally. And then of 3 to 6 millimeter probe depths, only 44% of the depth is covered. So historically thought of just as effective as adequate home care, but some studies suggest that it actually could be clinically more effective. Then there's subgingival tips, and they're basically 90% coverage in pockets of 6 millimeters or less, with decreasing coverage as the pocket depth gets deeper. So you can definitely, you have to be very careful with these subgingival tips, but they can cover a large area. Then the cannulas, which are basically like a blunt needle, have 75 to 100% coverage of the tip reaching the base of the pocket. But safety is huge concern, and only people with excellent dexterity should really be recommended to use those. So basically, indications for at-home use for oral irrigation: areas that are difficult to access with traditional mechanical methods, or open interdental areas, malposed teeth, exposed furcations, periodontal pockets, post-perio surgery, prosthetics, orthognathic surgery, implant maintenance, as long as they use the specialized rubber tip and not the metal. Patients with diabetes or immunocompromised patients, any ineffective interdental technique due to physical ability or compliance may be able to use the oral irrigator with no syringe. And then as far as efficacy for professional irrigation, basically it's only been shown effective if it's used multi-episodically. So that means if it's being used every 3 to 4 times a week. Okay, if you rinse with subgingival irrigate with Paradex once, it doesn't show a value. So you want to really consider the cost and the benefit when you're doing these things. If you're only going to do a single session of professional irrigation, you might as well use water. Okay, so multi-episodic use is shown to be effective. So whether that's the patient does it on their own subgingivally 3 to 4 times a week, or they come to the office and it's done. So here, patients, it may take, you may see a patient twice a week for, a month or two. So that would be a good opportunity when you could do oral irrigation, and it may have a benefit because you're doing multi-episodic and you're seeing them several times in a week. Okay. So indications for that are deep pockets, bleeding, inflammation, and when scaling has been found ineffective. It may have a role when ideal instrumentation cannot be met. Something you want to consider with oral irrigation is pre-medication patients. Those who require pre-med for dental hygiene care should be evaluated before recommending the use of an oral irrigator. They really should consult with their physician before you're recommending it. Okay, the incidence of a bacteremia ranges from 6% in patients with gingivitis to a high of 50% in patients with perio. Certainly, the healthier the tissue, the less of a bacteremia will be created. Okay, and it's the same thing with flossing, using an oral irrigator, flossing, that kind of a thing. It will create a bacteremia. So when in doubt, it's always best to consult with the physician.